When I think about the scope of adults with congenital heart disease, there are a number of numbers that I take with me. Some are easier to remember than others, but there's a general feel when you remember these numbers. 1.3 to 1.5, that's the number of million adults that exist in this country with congenital heart disease. And I take that number and make it a little bit more personal. 1 in 150, 1 in 150 adults in this country has congenital heart disease. That's a bit of a staggering number. Now let's make it even more personal. Knowing the size of every extended family in this country, that means about 1 in 10 extended families is affected by someone in that family who in their adult years has congenital heart disease. And now let's bring it down to even the most poignant number. Number 1. This is the number 1 birth defect. A lot of people don't like to say the word defect. Let's just say the number 1 birth defect is congenital heart disease in our adult years. In terms of the scope of what we face as cardiologists, there probably are few other aspects of medicine that have such a grand and changing panorama of disease and issues that we face in terms of changing physiology, changing outcomes over the course of a lifetime as we face with adults with congenital heart disease. And one of the issues is that on no side of that spectrum do we really feel fully prepared. In the pediatric years, we have a certain physiology and anatomy that we're used to dealing with. That changes. And as we reach our middle years and later years, new physiologies, new issues arise that the adult cardiologist, the internal medicine cardiologist, is in some ways better able to face, yet still feels undereducated and unempowered in many aspects based upon our past training and the rise of this population that hasn't faced us before with these issues.
It makes it challenging because we have to be able to understand the anatomy they were born with, the surgical procedures they had performed, and then what are the consequences of some of those procedures, some of that anatomy and physiology as adult patients. They also then develop forms of acquired heart disease on top of their congenital heart disease. They can develop coronary disease. They can develop heart failure, arrhythmias as well. And so all that together makes the population somewhat complex in terms of their evaluation, their treatments, how we're going to follow patients. So it is a very different population than those with acquired heart disease.
The internal medicine cardiologist is the home for the care for adult with congenital heart disease. As particular experts, we add to that home, but we partner with the primary care that lies with the internist and the internal medicine cardiologist.
And so the ACC has decided this is an important area that they should focus on in terms of education, but then also training. On the education side, a program has been developed called the PATCH program, and it's Provider Action for Treating Congenital Heart Disease. And it is a way in which the ACC is working with the Adult Congenital Heart Association, a patient professional advocacy organization, to try to educate and improve communication among internal medicine general cardiologists, the adult congenital specialists, and pediatric cardiologists.
And it's a program that occurs at the grassroots level of the American College of Cardiology's chapters in partnership with the college itself through the ACPC Council, together with patient advocacy organization, the Adult Congenital Heart Association. And it's a program designed to get the word out, to spread knowledge, a unique body of knowledge that's encompassed by care of the adult with congenital heart disease, together with improved awareness and improved access to care when needed to subspecialists who have trained in the care of adults with congenital heart disease.
And I say lastly, the ACC has developed guidelines, the ACC-HA guidelines for the care of adult congenital heart disease patients, which was developed in 2008, so that we do have some guidelines now that cardiologists can refer back to help them take care of this population.
In 2007, the American College of Cardiology recognized through a joint council for congenital heart disease that there were a growing number of stakeholders that felt an imperative, if you will, to provide access for the recognition that care for the adult with congenital heart disease was a unique subspecialty that encompassed a unique body of growing science, and growing experience.
And through amazing advocacy and work through ACC and other organizations, the American Board of Internal Medicine passed adult congenital heart disease to be a board certification. The American Board of Pediatrics has also passed adult congenital heart disease to be a board certification. So those two organizations together submitted an application to the American Board of Medical Specialties, and in December of 2012, that specialty, the American Board of Medical Specialties, approved the certification for adult congenital heart disease. So that was very exciting information for the field of adult congenital heart disease, and also, of course, for patients with congenital heart disease.
Just recently, the Accreditation Council for Graduate Medical Education, the ACGME, has given approval to accredit centers so that they can perform this level of training. So we now have the ability to certify particular practitioners with regard to their training, to certify centers for training, and yet one more excitement is that soon we'll be able to see centers themselves accredited not just in the training but in the care for adults with congenital heart disease.
Soon, programs will be able to apply then for accreditation through ACGME to have their fellowship program approved through this process. So all this together is exciting for patient care, to improve the quality of care for patients.
I think that there is no greater period of my life in terms of care for adults with congenital heart disease in this current era, when the stars really are aligning in terms of improvement, in terms of providing care, providing expert care, and providing quality to the patients that we know so need such.